As we make this move towards accountable care organizations, it's pretty clear that some are well-positioned to do this assumption of risk, and others probably not. What type of partnerships do you see developing for those that aren't an Ochsner and aren't doing that assumption of risk now? Because it seems like we'll be moving in that direction pretty rapidly.
Well, I'll kick it off. I think it has to happen, and I think that the things that have to happen are the partnerships between physicians, the alignment of incentives between physicians and hospitals have to happen as a core of that. Right now, the incentives are misaligned for physicians and hospitals to work together. I also think some of the rules in the Stark regulations are terrible, and I think they inhibit hospitals from doing and physicians in doing what they need to do in partnership. And we're going to have to change our mindset a little bit about thinking that we're doing the wrong things to thinking we're doing a lot of good things, and those relationships can benefit patient care. And I think that's going to be important in the future. I think understanding how the economic model is going to work across that continuum is going to be important. Will hospitals, for example, have direct relationships to self-insure companies and work with companies directly for the care of their population, from primary care to wellness and prevention, right through hospitalization and right into home health? And I think that's going to be an important piece. If we can cut out 20 to 30% of that cost curve, I think it can work. And I think those larger systems, like what Ochsner's doing and what Virtua will be doing, will help get us there. But you have to build a continuum model. You have to build the physician base. You have to build the wellness and prevention piece behind it, because if we don't control the chronic disease on the front end, it really doesn't matter what happens later, because you're still going to have a lot of cost in the system. So that whole model of, and I think if you've seen one accountable care model, you've seen one accountable care model in the country. They're all different. So I think everybody will have a little bit different model around accountable care, but it has to center around the continuum of care around the patient in supporting the patient in wellness and prevention of chronic disease.
Yeah, I would agree, and I think the payment mechanism will drive some of that. So the question is, if we go to a bundled payment, where does the payment go? If it goes to the hospital, I think you'll see physicians get real engaged to try to work with the hospital to figure out kind of how that bundled payment works and gets put together. But I think this is where you're going to see some systems, like Rich is saying, get really engaged and say, I'm going to learn that skill set, I'm going to work with my physicians, I'm going to figure out how I build more integration and more alignment with them. And I think those are the systems that'll do well. They'll work with the insurance company, they'll do direct contracting, but they'll figure out how to move forward and take some of that risk. I think you'll have others to say, well, it's not going to happen or it's not going to change, and I think those are the ones that are going to have a real tough time because their competitors are going to figure this out and are going to do it better. And I think people will move. If you look at the IT information we were looking at before this panel, who wouldn't look at that and say, that's a system I want to be going to because I want to book my appointments online, I want to look at my medical results online, and if you can't give that to me, I do love my physician, they're great, but I'm going to go to the system where I can get that. Or the physician might say, I'm going to go work at that system because I want those things. So I think you'll see more capable institutions draw the patients and draw the physicians. I don't know which one will come first, but I think you'll see those two things happen, and then I think those systems will be the winners.